The daughter of a man who took his own life after experiencing years of pain linked to botched dental surgery said she had lost faith in the system. Clive Worthington from Harlow, Essex, travelled to Hungary for dental implants in 2008. Several follow-up procedures from the same dentist back in the UK over the next 7 years were unsuccessful. The government said it was addressing a so-called loophole, which meant the 81-year-old missed out on compensation. Last week, an inquest concluded Mr. Worthington's death in 2022 was a suicide. Senior Essex coroner Lincoln Brooks said the long-term consequences of Mr. Worthington's unsuccessful dental surgery impacted significantly on his mental health and ability to cope with daily life. It's such a tragic end to a life, said Mr. Worthington's daughter, Gina Tilley. It just makes me so mad that it didn't have to end this way. In 2017, the General Dental Council, GDC, found Dr. Esker Gombos, who was employed by Perfect Profiles, at fault for the work. Mr. Worthington was awarded £117,378 in damages and legal costs at Chelmsford County Court in November 2019, one of the highest payouts for dental negligence in the UK. But the insurer, which covered Dr. Gombos, the Dental Defence Union, DDU, argued discretionary indemnity and refused to pay. The British Medical Association says discretionary indemnity is where legal and financial assistance is provided at the discretion of the provider, for example, not backed by an insurance contract between the healthcare professional and the provider. Ms. Tilley said the dental insurance system, especially discretionary indemnity, was madness. I've completely lost faith in the system. It's completely nonsensical. It's completely outdated, she added. The compensation was won by solicitor Paul Jevkins, who referred to discretionary indemnity as a loophole and said nowhere in the Dentists Act 1984 does the word discretion come up. Dr. Gombos and her former employer did not respond to the BBC's approach for comment. On its website, Perfect Profiles said it ceased trading in 2022. The DDU said it was saddened to hear about Mr. Worthington's death but could not comment on individual cases. The union also declined to comment further when asked why it did not pay out the awarded compensation. The GDC said patients must be able to seek compensation in the rare event that something goes wrong in their dental care, and it is deeply frustrating that weaknesses in the current legislation force the system to fall in this instance. The Department of Health and Social Care said that it had previously pre-existing concerns about discretionary indemnity. The government said it was continuing to look into the issue of clinical negligence as part of the Patterson Inquiry Implementation Update. The spokesperson for the department said, "We have made significant progress to improve patient safety over the last decade, including the introduction of the first NHS patient safety strategy from 2019. The spokesperson added, "We are working with the sector to improve access to compensation for clinical negligence and will ensure all changes are in the best interest of patients." Ms. Tilley said that she would continue to fight for justice for her father. "My dad had already started to contact the media while he was still alive. He knew that this wasn't right. I just don't want my dad to have died in vain because of this. I'll keep asking the questions and I'll keep fighting to try and get things changed." Mr. Worthington, who worked as a wood machinist, had 3 children and 5 grandchildren. A men's